Hello everyone, I am Dr. Noor Faraz and today we are going to talk about is humerus, which is the longest bone of our upper limb. The humerus is the single bone in the upper arm that connects the shoulder to the elbow joint. It plays a crucial role in enabling the wide range of movements of the arm. So understanding anatomy of this bone is very important. For our easy understanding, I will divide this bone into three regions. The first is the proximal region. The second is the shaft or the body of the humerus, and the third one is the distal part. So first we will start with the proximal part. The proximal part contains the head of the humerus. The head of the humerus is smooth spherical structure and forms the proximal end of the humerus. It is oriented superior-medially and slightly posteriorly. This articulates with the glenoid cavity of the scapula, creating the glenohumeral joint. Now we have the anatomical neck. This is a constricted area that separates the head of the humerus from the greater and lesser tubercles. Now you can see here, it is separating the tubercles from the head. It serves as an attachment site for the capsule of glenohumeral joint. Now the next one is the surgical neck of the humerus. This is a constricted portion at the proximal shaft of the humerus. It is situated distal to the greater tubercle and lesser tubercle and proximal to the deltoid tuberosity. Now surgical neck is much more frequently fractured as compared to the anatomical neck. Fracture takes place when the humerus is forced in one direction while the joint capsule and the rotator cuff muscles remain intact. Now the next one that you can see here is the greater tubercle. This is a large eminence found on lateral aspect of the proximal end of the humerus. It projects laterally from junction between anatomical neck and body of the humerus. It is located posterolateral to lesser tubercle. Greater tubercle has anteromedially located crest and three different facets providing attachment to supraspinatus muscle, infraspinatus muscle, and teres minor muscle. The crest of the greater tubercle is also called as lateral lip of bicipital groove. Now the next one is lesser tubercle, which is also known as tubercle of Weber. It is a small eminence found on anterior aspect of proximal end of humerus. It projects anteriorly from the junction between the anatomical neck and body of the humerus. It has a posterolaterally located crest. This crest is insertion site for subscapularis muscle and transverse humeral ligament. The crest of lesser tubercle provides insertion site for teres major muscle. Now next is the intertubercular sulcus, which is also known as bicipital groove. This groove separates the greater and the lesser tubercles. Its inferior end is continuous with the anteromedial surface of the humerus. The bicipital groove is converted into canal by transverse humeral ligament which connects the lesser and greater tubercle. Let me show you how. As you can see, the transverse ligament is connecting the greater and the lesser tubercles. This canal allows passage for the long head of the biceps brachii tendon and ascending branch of anterior circumflex humeral artery. Now next we are moving to body or shaft of the humerus. We find several important landmarks and surfaces here. Now first we will start with the deltoid tuberosity. This is a rough triangular prominence at middle third of the anterolateral surface of humerus which provides an origin site for the deltoid muscle. As you can see, its triangular shape. Now the next one is the radial groove. This is a shallow groove that runs along the posterior aspect of the shaft in an inferolateral direction and allows passage for the radial nerve and the deep artery of the arm. As you can see, it is in an inferolateral direction. Now we will start with the borders of the humerus. We have three borders: the anterior border, the lateral border, and the medial border. First we will start with the anterior border. The anterior border or margin is located along frontal aspect of the body of the humerus. It extends inferiorly from crest of greater tubercle of humerus to the coronoid fossa. Now this is the anterior border. The anterior border separates the anterolateral surface from the anteromedial surface. Now the second border is the lateral border of the humerus. It extends from the lateral supracondylar ridge inferiorly to the posterior aspect of greater tubercle superiorly. This margin is located along posterolateral aspect of body of the humerus. Now this one right here is the lateral border of the humerus. This border separates the anterolateral surface from the posterior surface. Now last we have the medial border of humerus. It is continuous superiorly with the crest of lesser tubercle and inferiorly with the medial supracondylar ridge of the humerus. Now this one you can see is the medial border. The medial border separates anteromedial and posterior surfaces of humerus. Now the next are the surfaces of the humerus. The first one is the anterolateral surface of the humerus. Now here on this surface you can see the deltoid tuberosity. The anterolateral surface is bound medially by the anterior border and posteriorly by the lateral border and lateral supracondylar ridge. The next surface we have is the anteromedial surface. This surface is bound posteriormedially by the medial supracondylar ridge and the medial border and laterally by the anterior border. Now the last one is the posterior surface. The surface is bound laterally by the lateral supracondylar ridge and lateral border and medially by the medial supracondylar ridge and medial border. Now we will come towards the distal humerus. At the distal end of humerus we find several important structures that articulate with the bones of the forearm. Now this rounded projection that you can see is the capitellum, which articulates with the radial head forming part of the elbow joint. Now this pulley shaped structure is trochlea, which articulates with the trochlear notch of the ulna, also contributing to the elbow joint. Now this depression above trochlea is the coronoid fossa, which accommodates the coronoid process of ulna during flexion of the elbow joint. Now this shallow depression just above the capitellum is the radial fossa located along the lateral aspect of distal humerus. Now on the posterior side we have a deep depression posterior to the trochlea that receives the olecranon process of the ulna during extension of the elbow joint. This is olecranon fossa. Now next we have is the medial epicondyle, which is a prominent projection on medial side which provides attachment for flexor muscles of the forearm, the pronator teres muscle and the ulnar collateral ligament. It also features a groove for ulnar nerve on posterior surface of medial epicondyle. Now we have projection on the lateral side called as lateral epicondyle. It gives attachment to the extensor muscles of the forearm, the supinator and econius muscle, and the radial collateral ligament. Then we have the medial and the lateral supracondylar ridges. The medial supracondylar ridge is more curved as compared to the lateral supracondylar ridge. They provide attachment sites for various muscles and intermuscular septa. Now here you can see is the elbow joint. I hope you guys have understood the concept. Thank you.